Having hyperlordosis in your lumbar spine directly points to the idea of a lower cross syndrome. Basically, your pelvis can be viewed as a rotating object controlled by four strings. The tension in one pair of strings can change the position of the pelvis, which, in turn, affects the tension in the other pair of strings. When you're sitting, your hip flexors become accustomed to a shortened position, while your gluteal muscles adapt to a lengthened one. When you stand up, this shift in tension introduces uneven forces on your pelvis, resulting in its rotation. This rotation pre-shortens your lumbar extensors, increasing their excitability, and pre-lengthens your abdominal muscles, making them more lazy.
The only thing lazy here is the amount of research that went into the subject. Now, I don't make posts bashing other accounts, and this account creates awesome animations, and I use them, and I'm grateful for them. But this is a myth that is still being perpetuated and has no evidence to support this theory. In fact, the research shows the exact opposite, that anterior pelvic tilt is normal and is not a sign of pain or dysfunction. Males have an average anterior pelvic tilt of 7 to 9 degrees, where females have an average of 12 to 14 degrees. And about 80% of the population has these averages of anterior pelvic tilt, meaning anterior pelvic tilt is normal. Your body isn't some simple system of pulleys and gears where you tighten one side and the other side moves. This leads to further myths like glute amnesia or a weak core causing low back pain. However, if you have low back pain and you find your symptoms increase in an anteriorly tilted position, it doesn't mean you should just ignore it because it's normal. Many people with chronic low back pain might be extra guarded in squeezing their low back muscles, causing an exacerbation of this posture. So here are a few exercises you can do to work on this painful tilt and calm down your low back. First, put your feet in a 90-degree position and let the low back go flat into the floor while you practice deep belly breathing. This will take pressure off the low back as it sinks into a neutral position, as well as calm down the muscles of the lower back, as well as your nervous system. Then next, progress this into a dead bug exercise. On your back, arms and legs towards the sky, press the low back into the floor to engage the core and stay out of this arched position. Then alternating each side to improve the stability of your core and spine. Then last, get into our bear position on all fours. Lift up the knees where you once again flatten the low back as to engage your core and hip flexors, holding for time. These will not fix your anterior pelvic tilt, but they can help you better control it and help reduce your pain if you feel sensitive in this tilted position. Let me know if you thought this video was helpful. And as always, if you'd like more help getting a specific plan to fix your back for life, just text me the word pain to 317-751-9509 and you can get a free back pain fix demo with my team.